And COVID-19 vaccines can start going into little arms tomorrow. The CDC has given the final approval for COVID shots for babies as young as 6 months old. Christopher Salas is in our Washington bureau with more.
The vaccine rollout will begin this week, and millions of doses have already been ordered for doctors' offices, hospitals, and community centers across the country. The CDC's panel said the vaccine offers protection against hospitalization, death, and the uncertainty of long COVID. Pfizer's vaccine is 1/10 of the adult dose, and 3 shots are needed. The company said it has an 80% efficacy rate, but experts say their data was limited. Moderna's vaccine is 2 shots, each a quarter of its adult dose, and they're given about 4 weeks apart. Its effectiveness is about 40% against symptomatic COVID. The president said following the announcement that this was a day of relief and celebration for parents across the country. Here's what the CDC director said.
We now know, based on rigorous scientific review, that the vaccines available here in the United States can be used safely and effectively in children under 5.
Roughly 18 million children will be eligible, but it remains to be seen how many will ultimately get the vaccine. Less than a third of children between the ages of 5 and 11 have been vaccinated, and the Surgeon General says the federal government will be rolling out a national education campaign. In Washington, I'm Christopher Salas.
And the White House says vaccines will be available at pediatricians' offices, children's hospitals, and select pharmacies and public health clinics across the U.S. And here's a look at COVID-19 numbers in California right now. The test positivity rate is 10.5%. That's an increase of more than 2% from last week's average. Hospitalizations are also slightly rising. 2,700 people are currently in the hospital with COVID-19. However, we aren't even close to where hospitals were just a couple of months ago. This is the 6-month average of hospitalizations in California. The CDC has identified several counties in Northern California that have high community levels of COVID-19. This includes Yolo, Sacramento, Butte, Placer, and El Dorado counties. And 2 more states, Indiana and Missouri, have reported their first cases of monkeypox. The CDC reports that 113 monkeypox cases have been confirmed in 21 U.S. states and territories. That's as of Friday. Missouri Department of Health officials say their state's first case is a Kansas City resident who had recently traveled out of state. Indiana health officials are not releasing the location of their monkeypox patient who is currently in isolation. Most cases, 75% or more, are from people who think they may have been exposed during international travel. The U.S. has ordered more than 300,000 additional doses of the vaccine for monkeypox, and there are more ready for order if needed.